Hi, my name's Dr. Beck Tucker. I'm one of the dentists at Advanced Animal Dentistry, and Maple and I are here to talk to you about ball therapy today. Bye. Has ball therapy been recommended for your puppy? If so, I'll try and give you some tips and techniques for introducing it effectively at home. We tend to use ball therapy for puppies that have a malocclusion. So generally speaking, it's for those where the lower canine tooth is erupting, but it's a little bit narrow or heading towards the roof of the mouth. If we get our timing correct and we implement ball therapy at the correct time, for some of these pups it can save them from undergoing more expensive and invasive treatments. It's important to know that ball therapy doesn't work on deciduous teeth. It won't sort of correct the position of an already fully erupted tooth, but it can have an effect of redirecting the eruption pathway very slightly in teeth that are actually undergoing an active eruption. The things that are really important to know with ball therapy are we need to select the right kind of ball. So we need not only the right size ball, but the right consistency or density to the ball as well. There's a lot of different products on the market, and we've found a few that work for us. We tend to recommend a ball that essentially sort of sits between the lower canines, where ultimately the tips of the teeth are contacting sort of that lower curvature of the ball. So when the pup bites down on it, the ball is actually pressing down between the teeth, and it's actually exerting a force that helps to tip them outwards. A ball that's too big will just sit on top of the teeth, and a ball that's too small will just fall down between without actually exerting that force. The texture is also really important. We recommend something that is hopefully something with a little bit of weight to it, and also just a decent amount of resistance. We don't want it being rock hard, like a cricket ball, for example. We also don't want it to have a rough surface texture like a tennis ball. The tennis balls tend to be a little bit too compressible, but also the fibers that coat them can over time wear the teeth down as well. The rubber in these Kong balls is fairly ideal. We found them to be quite effective, and we can get a range of sizes as well. There's other balls that you'll find. We tend to avoid things that are able to be compressed easily, because they're not going to exert an actual force onto the tooth. The tooth is simply going to collapse the ball. And you can see that they're not really going to do the job that we're asking. Rope toys are also fairly ineffective for this purpose, simply because the tooth will often penetrate between the actual layers of rope, so they're not doing what we want by exerting the actual force onto the tooth either. We find it really important to introduce ball therapy as soon as you know your pup has a potential problem. It's only effective for a very short window of time. However, we want your pup to be used to actually performing this sort of therapy or treatment before the time it needs it. We find it most successful when we pick up on this problem potentially in a puppy and we're dealing with their mouths, and we want to introduce this behaviour before their permanent teeth erupt. That means that they've already gone through the learning phase of actually performing the ball therapy. They've developed an interest in playing with balls and the likes of that. If you introduce this to a pup that's never been, I guess, keen on playing with balls or never had balls to play with before, we often find that it's less successful because you've also got to teach them what to do with the toy. For ball therapy to be effective, we ideally want your pup to be doing it as frequently as possible. It's recommended that we at least have 3 sessions of about 15 minutes of play each day for them, and for this to be effective. In reality, you can't do it too much. In order to get your pup to sort of engage in play, we recommend trying to make playtime as fun as possible. Strategies that you can use to encourage your dog to play with the ball and make it as fun as possible are to place some peanut paste or the likes of that on the outside to encourage them to actually pick it up and play with it. We've also found that putting the actual ball in a sock and tying a knot around it encourages a more tug-of-war type game. This is something that's often a little bit more fun and interactive for pets, and they'll often grasp the ball more firmly and exert sort of a little bit more force with their bite as well, so that can be very, very effective. If your pet is really sort of not engaging in this, you can also use digital pressure on the teeth to actually place an outwards force on those erupting canines as an alternative to the ball therapy, or as a complementary treatment as well. Ball therapy can be a really important strategy for managing particular types of malocclusion. It's really important, however, to make sure that you get a correct diagnosis and ensure that this is the right treatment for your pet. If you are worried about a malocclusion in your pet and wondering if ball therapy is right for you, contact your vet or reach out to us.